Okay, you guys can turn in your book to page 511. Go ahead and get your PowerPoints out, and we will go over pretty quickly these kidney diseases or renal diseases. So one of the very basic, hold on, test for urine is urinalysis, and it just tests for all kinds of stuff. So that's what I was talking about that, but usually urinalysis can tell you lots of things. Blood tests can too, because obviously the kidneys filter the blood, so we know that they have a big blood component as well. But a lot of times the urinalysis is really easy to do, and you can do it really quickly, and you just usually use like a dipstick, and then it's got different colors on it if things are present or not, and you use that. But anyway, so we'll look at some different diseases and disorders. So assessing renal function, urine normally clear and yellow, but it can indicate a UTI if it's real cloudy. Normally the pH, like it says here, could be anywhere from 4.5 to 8, which is a really wide range, but those are all can be normal. Specific gravity is another thing that's measured. It says the urine's mass per unit volume. So it's looking at density of water. Normal specific gravity is 1.003 to 1.035. The higher numbers means it's more concentrated. Usually, like someone's dehydrated, it's going to be more concentrated because your body's trying to absorb more water to retain that. Typical daily volume of urine is 0.5 or half to 2 liters. That's a normal urine output. Chemical composition of urine, so it's 95% water, 5% waste, mostly water. If you're not drinking enough water, though, that will change. It will be a lot more concentrated. As it's a type of nitrogenous waste produced by the normal chemical breakdown of proteins. So the body breaks down proteins. This nitrogenous waste is what's included in that. Potassium, chloride, sodium, and other ions are typically present, so you see those. You don't want to see too much, but you do see those in there. Glucose says the presence of blood, red blood cells or white blood cells, or protein or glucose usually indicate that there's something not right. We talked about glucose in the endocrine system. We did a UA, or a glucose check in urine, and glucose means that your body's not using up your glucose the way it needs to. It's really easy to test. Usually for proteins, they test for what's called ketones, and that's what they're looking for. That. GFR is something that they can also test for, glomerular filtration rate, but that's a blood test. So usually they're going to look at a GFR trying to determine how well your kidneys are actually functioning. Because if the substance in blood plasma is easily filtered by the glomerulus, and is neither reabsorbed or secreted by the renal tubules, then the rate at which the substance collects in the urine should be an indicator. And what you're really looking at is glomerular filtration rate. So how is the glomeruli itself actually functioning? Creatinine says on 512, the most common way to estimate GFR is by measuring blood concentration of creatinine, a normal byproduct of muscle metabolism that's produced at a steady rate. So you have a very specific level of creatinine that should be in your bloodstream. Creatinine is freely filtered by the glomerulus. If it's high, then creatinine will be removed rapidly from the blood. And if it's really low, if the creatinine blood concentration, if the GFR is high, creatinine will be removed rapidly from the blood by glomerular filtration. In that way, the creatinine blood concentration will be low. If it's already low, then it won't be removed. So you'll see that in the urine, it will be considered high, or blood will be considered high. So high blood concentration is saying that your kidneys are not working like they need to. You don't want a high creatinine level. But that's something that is readily tested for. It really gives an idea of creatinine level. A lot of times people will take your creatinine level. Like if you're going to go to have like a CAT scan or something run, and they need to make sure that your kidneys can filter out the dye. Like if they're going to put dye in your body to check a CAT scan or something like that, they want to make sure that your kidneys are going to be able to filter that dye out, because otherwise it can be dangerous if it stays too long. It can ruin your kidneys. Kidneys aren't functioning the way that they need to. And so that's one thing that they'll check for. If your creatinine's too high, they're not going to let you get that dye because they're worried your kidneys are not functioning the way that they're supposed to. The glomerulus is not filtering like it should. Diabetes, I'm going to move pretty quickly because we've already talked about diabetes in the endocrine system. But remember, diabetes mellitus, that's your typical diabetes, your type 1 or type 2. Usually you'll find glucose in the urine. We know that you also find elevated glucose in the blood. And we've already studied about a lot of this. It says the Latin word mellitus means sweet, FYI. So we know type 1, remember, is the type that is more genetic, right? You acquire it. Usually those people are thin, younger, not necessarily just a kid, but it could be younger, versus type 2, which is an acquired thing. At some point you either could have started, I mean, it can be predisposed to it and it be genetic, but you know, it's something, it's a result of obesity or diet or something along those lines. Let me read on here. I want to read to you guys real quick. It says, you know, remember type 1 diabetes is an autoimmune disease, so the immune system attacks your insulin producing cells in the pancreas. Type 2 diabetes is one that makes it, your body just isn't able to either create enough or your body quits responding to the insulin. Both types mean that you can't use glucose the way you need to. The next page, it says, illustrates carbohydrate digestion, blood glucose. Diabetes 1 doesn't make insulin, doesn't work, so you have to give insulin. I'm at the bottom of 513. As we discussed in lesson 14.2, glucose normally is filtered by the glomerulus and fully reabsorbed in the renal tubule. But in diabetes, there's so much glucose, right, that the filtrate, it just can't pick it all back up. Sometimes it says their urine can even have a sweet odor. Definitely their breath if they have really high concentration levels. Carbohydrate digestion leads to an increase in blood glucose levels. We know that carbohydrates turn into glucose. Increase in blood glucose level causes the pancreas to secrete insulin. We know that, right? Your blood sugar goes up. Pancreas says, hey, we need more insulin to get this back down, so it secretes more insulin. And increase in blood insulin level causes liver glucose uptake. So your liver's like, hey, I got to take in more glucose, which stores it as fat. And then skeletal muscle will take that in too, convert it to glycogen, which is the way we store sugar. Now, the second type of diabetes is diabetes insipidus. And we talked about this, but it's been a while. Also, it was in the endocrine chapter. This means that usually the symptoms is that they're going to have a large amount of really diluted urine. But this is an endocrine issue. It's characterized by the production of large amounts of urine, more than 12 liters a day in severe cases. That's a lot. It's really diluted. Urine-specific gravity is very low, and it's mostly water. It's usually caused by failure of the pituitary gland to produce antidiuretic hormone. Okay, so remember that was part of the endocrine chapter, your antidiuretic. So diuretic makes you go to the bathroom. So you have a hormone that says, nope, we need the water, let's hold it in. But because they're not producing a normal amount, that hormone is just letting the body get rid of extra water. Okay, let's see, where are we? Chronic kidney disease. All right, chronic kidney disease is usually kidney damage. So usually you'll see lots of protein in the kidneys. That creatinine will be really high. That's usually a sign that there's something wrong. Glomerular filtration rate is less than 60 millimeters per minute for at least 3 months. That's what's considered chronic kidney disease. Diabetes is the most common cause. So diabetes has a bad effect on the kidneys themselves and how they function. Hypertension is the second one. So long-term high blood pressure can cause you to have kidney disease. That's why it's really important. You know, you think, okay, well, I feel fine. What does it matter that my blood pressure is too high? Well, it makes your kidneys work so hard. Remember that the pressure, the blood pressure in the glomeruli is really high. And so if you're not, if your blood pressure is also high, on top of that being so high, you know, it can really damage the kidneys. Diabetes and high blood pressure, it's really important to make sure that those are taken care of. Typically does develop pretty slowly. It says when GFR decreases to 15 milliliters per minute or less, then we call that kidney failure, renal failure, the most severe stage of this disease. And that means that the kidneys just can't function anymore the way that they need to. It says without treatment, a person cannot survive very long in this state. Waste products accumulate in the blood and levels of pH and various ions are no longer well controlled. So they usually have to have renal dialysis. This is a medical technique in which the blood is filtered through a machine or a kidney transplant. And because the supply of donor kidneys is so low, most patients undergo dialysis just because they can't get a kidney fast enough. Or maybe their life expectancy is very short anyways. But it's really, dialysis is so hard on people. It's not just like, oh, we'll get this. It's not like a medication. I mean, it takes hours. Most patients go in for like 6 to 8 hours, 3 days a week. And there's no like, oh, I can't go today because I have whatever. You have to go. I mean, you have to get rid of that waste in your bloodstream. There's a really good picture on 516 that talks about dialysis. And you can see, okay, so it removes the blood and it cleans it. This dialyzer cleans the blood, basically, gets rid of the waste. So waste goes in, or waste leaves, and you've got this fresh dialysate fluid that goes back in, pumps it back into your body. So you've got a shunt, usually in their arm. Sometimes it's up in their upper arm, but usually in the forearm somewhere. And they just 3 times a week they connect to that shunt, run their blood through that machine, and put it back in. And if they don't, I mean, those toxic levels of that waste just goes in the bloodstream. And this makes it, you just can't live that way for very long. Hemodialysis, that's the typical kind. That's hemodialysis. There's also peritoneal dialysis. And this one's a little bit different. And we just talked about the peritoneum, that's the abdominal cavity. Dialysis fluid is added to the abdominal pelvic cavity through a surgically implanted port in the abdomen. So you have a port and it's got dialysis fluid in it. And so as it sits in the abdomen for an hour or more, it absorbs water and waste from the capillaries in the mesentery, remember, which is that membrane that attaches, that kind of holds your intestines in. and then elsewhere in that cavity, and then it actually separates the blood from the dialysis fluid. So that can actually be done at home. People can do peritoneal dialysis at home, and it lets your peritoneum act like that membrane. Very, very high risk of infection to do that at home. Just kind of depends on the person if they're comfortable doing that or not. A few other things, kidney stones, says it's not really a stone, it's usually a mass, forms in the kidney itself, and usually made of calcium, but they can have other things too, uric acid and so forth. And I've seen kidney stones before. There's some kidney stones in the picture on the book on 518. Usually they form in the renal pelvis, that little collecting area, but they can get in the ureter or the bladder. Usually they start moving, and that's when people start having symptoms. So they move from the renal pelvis into the ureter, and that's what causes a lot of pain, especially if it's trying to go through the urethra. Urethra is smaller, and it's just, sometimes it can block it and cause damage. They have to go in and fix it. The fancy word for a kidney stone is a nephrolith. Litho, remember, is stone. Like otoliths, we talked about that. So they do a lithotripsy, and that's where they break up the stones, and then hopefully then they can move on through the urethra without issues. But a lot of times they're really spiny, like they're spiky, they get hung up, just cause so much pain and can block the ureters, which blocks urine and waste back up in the kidneys and can cause kidney damage too. And then the last one on here is UTIs, urinary tract infection. It's usually caused by bacteria that enter the urethra and move up into the bladder. Much more common for women than for men because the urethra is so much shorter in women. So bacteria doesn't have very far to travel. Men get them too, but typically it is women, have a higher risk. So pain during urination, sometimes they can cause bladder spasms, which is just like your bladder almost cramps up. If the bacteria continues to climb up, so it moves up into the bladder, climbs up the ureters into the kidneys, then you can get a kidney infection. And the medical term for a kidney infection is pyelonephritis. Pyelo means renal pelvis. It's that area of the kidney, that collecting area. So lots of pain and needs antibiotics. People with UTIs usually need antibiotics to get rid of it. And that's it. That's the end of the urinary chapter.